Welcome, 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 everybody. So here we are on Saturday, 6th of June, 2026. And thank you so much for taking out on your Saturday and spending it with us. Hi, Sandra. Good to see you. So can I know where are you joining in from? Like, please put in chat where are you joining in from and which time zone are you joining in? What time is it at your end? And we're very few of us, Mumbai. Thank you, Rekha. So I'd request if you switch your cameras on so that we can connect to the energy, and then it's better for us to present as well. Ahmedabad, thank you. UK. Wow. Can you please specify your name, Zoom user? I mean, it's awkward to call you Zoom user. So yeah, Louis. Hi, Louis. I remember. Great. So when I was today, we are going to when I was in your place, when I was learning about emotional wellness, I remember I was very nervous. I didn't know what to expect, but I was in a very bad space and I just needed help. And as and when I started learning more about it, I realized that my nervous system started to become calmer. I became much more settled and present in my environment, and eventually I learned different modalities for myself. And now I help people, deal with their struggles and come at peace with it, relax with whatever's going on in their life. So during our time together, we will get to practice emotional wellness skills on ourselves, and also you will learn how to use it on others. And I will share steps that you can follow or adapt uh, to your unique needs. And finally, you will learn how you can move towards your emotional wellness goals and solve your fears and stress. Okay, at times I will share some personal stories, and at times even you might share your personal stories. So we'll just raise our hands and promise to hold private, safe space for each other. So whatever happens here stays here. We don't go about talking outside about it. Okay. Now, let me start the presentation that I have. Yeah. So EFT, past therapeutic results, and feel happy and peace and relax. One of the reasons that I love EFT is because EFT gives very very quick results. Like it can instantly calm you down. And I'll be Tanuja. Hi, India, Kolhapur. Thank you. So I'll be teaching you a step how to calm yourself instantly. Like somebody who comes to us for private sessions, or any of the practitioners who've learned from us. One of the steps that we do is called as the triple calmer. All right, we start tapping under the eye, under the collarbone, and under the arms. Hi, Smita, good to see you. So this is called as the triple point calmer. All right. So somebody who's very upset, or is having a meltdown, or is really feeling crying a lot, not able to regulate themselves, emotionally dysregulated. We call this triple point calmer, and we can use this to relax them. So the way we go ahead with this is that when somebody comes to you, you just bring their entire attention to yourself. You'd be like, breathe, breathe. Like you have to be a bit firm. You cannot be very relaxed about it. You have to be firm so that their focus is with you. And you go like, breathe, breathe, look at with me, stay with me, tap under your eye, under your collarbone, and under your arms. Okay. I just wanted to check if I'm audible, or should I be louder? Is my voice clear? Okay. So we tap under the eye, under the collarbone, under the arms. So these are basically three meridians. All right. That helps us relax. So this meridian is the stomach meridian. Okay. Under the eye is the stomach meridian. When you tap here, your upsetness, your worriness, it all calms down. Okay. Under the collarbone is the kidney meridian. It's called K27 or kidney 27. And when you tap here, the life force goes through this meridian, and also a lot of frustration, fear, and all is stored in the kidney. So when you tap here, even that gets released. And then is the spleen meridian. Okay, This helps you to relax if you have chronic stress. Okay, if you tap here, it helps you to relax chronic stress, and it also helps you balance your energy of the body. So when we tap in this sequence, somebody will calm down instantly. All right, so you tap in this sequence and then you take a sip of water. All right, so let me proceed with the presentation. Yeah, so EFT Masterclass for faster therapeutic results. Feel happy, at peace, and relaxed. So who is this for? If suppose you are already a practitioner and or a healer or a therapist, and you have clients who come to you for um, stress eating, or they have some sort of a body pain, or they have some sort of fear or headaches, they have a lot of headaches, then such people can benefit from this program. Somebody who wants to lose weight or wants to gain weight or has digestive issues like irritable bowel syndrome or constipation or acidity, or somebody who tends to get into depressive tendencies, where they tend to go back into the past and think about all things that happened wrong with them, or somebody who is dealing with procrastination, dealing with coping with deadlines, etc. This program is for them as well. Then sometimes people have claustrophobia. They when they age, their features change, their body parts change. There are lines, wrinkles, the hair tends to. All of this also becomes a lot of stress for a lot of people. Somebody who likes to be alone, who doesn't like to meet people, meeting people becomes stressful. Or you've been into places like war, etc. You've been exposed to extreme conditions which have been traumatizing for you, then this program is for you. Okay. Again, if you want to learn about emotional wellness therapy technique, self-healing, self-development, and enhancement, you're already in a helping therapy or a coaching profession, you want to help yourself and others, you're seeking a new profession to help others heal and transform, and you're curious about EFT. So if you fall in any of this category, this is for you. Again, if you want to help your child and your family, you want to identify and release emotional patterns, you want to lose weight and have better health, you want to build confidence and self esteem, you want to boost your career and emotional balance, and you are in a revision mode and you want a deeper understanding, then again, this program is for you. And in our time together, um, we will in our time together, we will understand how our emotions and stress contribute to ill health. How can you reverse the negative effects of stress and create good health? What is emotional freedom techniques and how does it provide results quickly? And how can you help others heal and make it a profession? Okay. And house rules for today, this is not a coaching and a therapy session, but a training. It's not a do nothing and feel calm at peace session. We will talk about what are the processes that you need to follow if you want a transformation in your life. And this is not about how to take a magic pill and feel okay, like you do this session and everything becomes okay in your life. No. You must be able to learn and put the work and get put the work into get results. Okay. Now about me. Okay, this is about me. I was emotionally and physically drained and burdened. I delivered twin children, and one was diagnosed with autism, and I was unable to manage relationships and my own self. So I learned about EFT and I resolved a lot of uncertainties. I connected with my own self and I overcame doubts and I felt more confident. Now I'm a certified advanced EFT practitioner with Vitality Living College, and I'm also a EFT facilitator. I help individuals to overcome self doubt, release emotional pain and traumas, and move from the past and feel happy and relaxed. Okay, so I'll just speak a bit more about my story. So there used to be a time when I was absolutely clueless about what I wanted in life. Okay, I would always take others' permission. I would always ask for validations from other to do something, because I always wanted to be right. I wanted to do the right thing because I was not sure if I would do the right thing, right? So this became a huge problem when I became pregnant, and I conceived with twin children, and then my pregnancy was on bed rest, so it became really difficult for me. And when after 8 months of pregnancy, it was a planned C-section. my body completely fell apart. As in, there was no stamina. And then managing two children was very, very difficult. After 2 years, one child was diagnosed on the autism spectrum, and my entire life just fell apart. I didn't know how to deal with things. But again, I asked others what needs to be done. The doctor said that, you have to start with therapies. I went ahead with it. But it became very stressful for me because I was understanding everything. And when I started to understand everything, I started to understand that, what my childhood was like, what were the things, that I had experienced, what were the things that I struggled with. I began to understand a lot. And then, but the application part became really difficult because I realized that I had to unlearn a lot of things to become a better parent or to deal with autism basically. So what happened is that I would lose myself. It was difficult to manage two children with very different needs, then manage the family. I had to quit my career. I'm actually a qualified computer engineer, but I had to completely leave all of that. And yeah, then just be with children all the time, and I was not able to deal with it. My mental peace was going at a you know it was taking a toll. I was getting frustrated with my children, and I was not okay with it. Okay, I knew that I don't have to do this, but I didn't know how to deal with it. I was not able to stop it at all. And I realized I need help, because if this keeps going on, then I'm going to spoil my children, as in I'm going to really kill their confidence. I'm really going to, all my devils are going to come out at them, and I didn't want that. I realized it, thank God. And so I started looking for help, and I came across somebody who was practicing EFT, and I trusted her. And I had no idea at all, like how, what it is, what to expect. And I just went ahead with it. I was like, fine, just do whatever you can. I want to feel better. And when I went for those therapy sessions with that lady, in one or two sessions, I was all flustered before. In one or two sessions, I realized that I started becoming settled. I started becoming calmer. And nothing changed on the outside, but inside, I was more peaceful. And so I continued with therapies for about a year because I was benefiting a lot. I started enjoying it. I had a lot of benefits because of therapy. And then after a year, there was some challenges at home. And that time, therapies were not online. We had to go physically to somebody to take therapies. And it was not possible for me. After a year, my kids were still young. So I decided, instead of running here and there and seeking help from others, why not just learn it for my own self, so that I can, practice on my own self, and I can heal my own self. So when I when I learned EFT, I really began to understand myself better. I started to connect with myself better. I was able to understand why my children were also throwing tantrums. I was able to understand them better because I was giving myself space to heal. So from there, then I learned EFT. Then I became a advanced EFT practitioner. I became a EFT facilitator. I also did breakthrough NLP coaching. I'm also an under training practitioner of something known as energy flow, which is a somatic body work. Like, you have certain exercises to release the trauma that your body is holding on to. And we will be doing some energy flow exercises today in our time together as well. So proceeding with the presentation. Yeah. So, so these are some clinical data. Like 85% of the illnesses are stress related. 90% of doctor visits are also stress related. Leading causes of divorce, weight gain, obesity, and addictions is also stress related. And unresolved past trauma can lead to illnesses. Now, so something that I want to speak about now is easy. So anybody knows what unresolved past trauma is, or unresolved emotions are? You can put it on chat, or you can even unmute and share. So unresolved emotions basically would mean that, you came across a situation, you felt some heavy emotions, but you didn't know how to, release it. You still hold on to it. Not a closure, yeah. Like, that bothers you. Why did it happen? I was not able to deal with it, or why did such an incident. So that emotion which is stuck in your body, it keeps bothering you. It's not resolved. It's not got a closure, like how Smita mentioned on chat. So such emotions, when our body holds on to such emotions, it leads to illnesses. And what I want to talk about now is ACEs. It's called Adverse Childhood Experiences. This was a study done in the USA. It's basically, ACEs are stressful or traumatic experiences that can have a huge impact on health and wellness. And how can ACEs show up in children? So, children, who are fearful of other people, they have difficulty in sleeping, they have bedwetting issues, they have frequent nightmares, they have changes in their mood swings, then difficulty in showing affection, difficulty learning in school, and avoiding situations similar to the past trauma. And ACEs in adults can show up as anxiety, depression, post traumatic stress disorder, phobias, eating disorders, substance use disorders, mood disorders, and insomnia. Now, if anybody has experienced any of this while growing up, they are bound to have ACEs. So, if somebody has gone through physical abuse or emotional abuse or sexual abuse, or somebody has felt a physical neglect or an emotional neglect, or somebody in the family has mental illness, or a relative in the family is in the jail, or the mother was treated violently, or there was substance abuse, or the person comes from a divorced family, then there are chances of that individual having ACEs. So what I'll do now, I'll just pause at the screen, so that you can give yourself one point for anything that you've experienced while growing up. And when you get a score of it, then I'll share the slides ahead. So if you've had like a physical abuse, or you can give yourself one. If you've got emotional abuse, you give yourself one. Sexual abuse, one. So give one point for each. And when you're done, you can just put it on chat. Okay. Thank you, Rekha. You can, if you're comfortable, please put your score on the chat box, or you can just let me know that you're done. Thank you, Smita. Okay. So I'll move ahead. So suppose if you have an A score of 0, then there is low likelihood of facing adverse health conditions in adulthood, low chances of taking up smoking, attempting suicide, experiencing depression, and participating in substance abuse. Okay? If your score is 1 to 3, then chances of using illicit drugs increases from 11.3 to 21.5%. The associations with alcoholism, depression, and suicidal tendencies also go up correspondingly. Social, emotional, and cognitive impairment is likely, as is the possibility of disturbed neurodevelopment. If your score is 4 and above, then the possibility of diseases, disability, and social problem substantially increases, and the early death is also likely. Chances of becoming an alcoholic increases fourfold, while the possibility of suffering from chronic depression triples. Chances of heart diseases and stroke double, while the likelihood of severe financial issues and problems while working triples. So these are some of the behaviors that person with ACEs can show, like lack of physical activity, smoking, alcoholism, drug abuse, missed work, then severe obesity, diabetes, depression, suicide attempts, STDs, heart disease, cancer, stroke, COPD, and broken bones. Okay. And so basically, somebody who's had ACEs, the nervous system is at an alarm mode. Okay. The nervous system is at an alarm mode, and somebody who needs to work with a person like this, the person needs to, a therapist or a counselor or a healer who would want to work with somebody who has ACEs needs some of these qualities, like deep listening, uninterrupted listening, then good questioning skills, so that you can reach to the root cause of what is actually going on with that individual. And also understanding how to balance or relax the nervous system. So some of the energy flow exercises that we do helps us relax the nervous system. Okay, the first one that we spoke about at the beginning was the triple point calmer, where you tap under the eye, under the collarbone, under the arms. This helps you calm down instantly, right? Some of the other exercises could be like, you can give pressure like this on your collarbone, on the sides of the collarbone. This helps, relaxing the lymphatic system over here as well, right? On the other side as well. Okay, it might be painful for some of you, because if there's a blockage in that area, then it might hurt, but this will help you relax. Okay, then the other point is, massaging here on the underarm here. Okay, this also can be painful. If your cortisol levels are high, then this point can be sore and it can hurt when you do this. On the other side as well. And then when you place your thumb like this, there's a point where the middle finger comes. There's a sore point there. If you press there, it hurts. Are you able to find it? Is it hurting? So these points also help you. Like, you can do it on both sides. They help clearing the lymphatic system, and it helps relaxing the nervous system. Okay. Amazing. So after we do these exercises, we take a deep breath in through the nose. We breathe out through the mouth. Because, when you breathe out through the mouth, you help your nervous system to relax. Your lymphatic systems to relax. And then we drink water. So make sure that you're drinking water, because when we do these exercises, the toxins of the body, they're released, and, water helps them dilute it or release it. So, moving. So whenever, somebody comes to us for therapies, we make sure that, first they are relaxed in their nervous system. When they come in this hyper alert mode, we make sure that we do these exercises, we help them relax, and then we go on to, speak about the trauma or the difficulties that they're facing. Because if we directly jump onto the trauma, or we directly talk about the trouble that they're dealing with, then, they might relive the trauma all over again. And it's like, making them go through that experience again. And sometimes it becomes too much. So first we help them relax the nervous system, and then we go on to the talking. And while talking also, we're very careful that, the way we ask questions, the way we help them, feel safe, so that it feels safe for them to speak about what's going on in their life. And then we're able to help them better. Okay. So moving on, So just a minute. So health conditions associated with ACEs. So people can deal with autoimmune diseases, cardiovascular diseases, chronic obstructive pulmonary disease, diabetes, cancer, depression, and substance use. Okay, so studies have shown that, I'll just read it out. So in autoimmune, among patients with lupus, 63% reported having one or more ACE, and nearly 20% had four or more ACEs. People who had cardiovascular diseases, the research has shown that a strong association between exposure to ACEs and cardiometabolic outcomes, including heart disease, hypertension, and obesity. So people who have COPD, in a study on ACEs among individuals with COPD, after controlling for smoking and other risk contributors, the risk of COPD increased as the number of ACEs increased, suggesting that ACEs were independent of risk factors. ACEs exposure increase in diabetes, ACEs exposure increases the risk of type 2 diabetes by 32% compared to patients with no ACEs. In cancer, ACEs strongly predict behaviors that increase the risk of adult cancer. Having at least one ACE is associated with almost 3 times the odds of depressive symptoms among individuals reporting poor perceived social report. Now, according to a 2018 study, adults who experience household abuse were 30% or more likely to binge drink alcohol than general population. So, yeah, a lot of health issues associated with somebody who has ACEs. So moving on, we'll speak about suppressed emotions. Okay, suppressed emotions increases the risk of cancer by 70% and heart diseases by 47%. So what does suppressed emotion do? Suppressed emotions are basically, you came across an uncomfortable situation, and you felt all kinds of emotions which were heavy, which were not comfortable, and you probably wanted to throw a tantrum or shout, but you were not allowed to do that. I also know, like a lot of times, when children are growing up, they are told that you cannot shout, keep your volume low, behave yourself, you cannot misbehave, you cannot throw tantrums like that. But what a child is actually doing when the child exhibits such behaviors, the child is basically releasing the heavy emotion that the child is feeling. Now, if the child is taught to shut down, that, stop, you cannot behave like this, you cannot shout, you cannot express yourself, they tend to hold suppressed emotions in their body. And it really interferes with your physical health. Similarly, we have something else known as unexpressed anger, and anger is also known to be linked to cancer. Now, anger is something that we are taught. We are taught that anger is bad. You shouldn't get angry. If you are angry, your health will get impacted. If you are angry, other people also around you damage other people also. But basically, we need to learn how to manage anger. Okay, we cannot hold on to if you are getting angry and you tend to hold it back, you tend to keep it to yourself, it's going to destroy you, because suppressed anger, it impacts your liver, and the first organ that gets impacted because of anger, suppressed anger, is your liver. If you don't know how to deal with anger, if you don't know how to release anger, your body goes for a toss. You'll see that you'll invite multiple diseases. But because for me, I remember I also had a lot of anger. I still have anger issues, but I don't tend to get so stressed about it now. But there was a time when I would get angry even for the right reasons. I used to feel guilty because I was taught that being angry is wrong. So I used to go on another guilt trip every time I felt angry, and that used to create another trauma for me. That how could I be angry? Why couldn't I control myself? Things like that. So it really impacted my health a lot, and it made me very uncomfortable. Like every time I went through a situation like that where I got frustrated or I got angry, I used to really punish myself. I used to really be hard on myself, that how could I do this? And then I would get into this apology cycle. Like I would go about seeking apologies from everybody, whether I'm wrong or not wrong. So I worked a lot on that, so that I become okay with if I get angry, then I forgive myself, and I try to understand what's going beneath. What's the reason that's making me angry? Because a lot of times you get angry because there is fear, or fear of something, fear of feeling weak, or fear of not able to deal with the situation. And you think, if you show up anger and if you're trying to be controlling, then probably the situation will get handled. So anger, it's very important how to deal with anger, how to learn how to manage anger. So I'm going to teach you another energy flow exercise today. This is called tantrum release, and this really helps in releasing the suppressed anger or unresolved anger, unexpressed anger. Okay. So the first step is, and I would really want you all to please turn your cameras on, because when we do these exercises together and I get to see you, then I'm able to connect with your energy better, and I will be able to guide you also whether you're doing the exercises in the right way or not. So the first step is to identify your collarbone, and there's a slight dent under the collarbone. Okay, it's the case 27 point, the kidney meridian. We begin by tapping here. Okay, we begin by tapping under the collarbone, gentle. Okay, you don't have to be very hard. The second step is to stamp your feet on the ground. Like you're stamping your feet on the ground, you're tapping under the collarbone, stamping your feet simultaneously. We do this simultaneously. And the third step is you take a deep breath in and you shout out, ah! Ah, ah. And take a deep breath in and take a sip of water. Yeah. So this is really good to release your suppressed anger. In fact, any kind of heavy emotions that you're feeling. So this exercise, my voice also becomes better after I do this exercise and this training, because I suddenly feel relaxed after doing this exercise. So this is a beautiful exercise. You can even teach your children to do this. You can encourage them to make it as their daily practice, because children a lot of times they don't know how to articulate their emotions. They tend to they will come up with various behaviors. So this really helps them to relax, feel regulated, and it's good for us as well, because see, we're tapping under the collarbone, which is K27. Okay, it's the kidney meridian. It holds anger, resentment, a lot of fear. Okay, when you're stamping your feet on the ground, your feet has all the meridian points of all the organs in the body. So you're stimulating all the body parts, okay, when you're stamping your feet. And then when you're shouting out, your vagal nerve is the largest nerve in the body. And when you take your sound out, when you sing, when you hum, or when you're shouting like this, the vagal nerve gets relaxed. And when the vagal nerve gets relaxed, a lot of stress is released. Okay, you're able to deal with a lot of stress, or manage stress better would be the right thing to say. Okay, so it's a lovely exercise. You can practice this for yourself in a closed room, or in a place where it's okay for you to shout, and even teach your children how to do this, because it will help them as well. Yeah, when children are exposed, and children are very open, they're very open to these ideas and therapies and exercises. They just do it, they just, if they're having fun, they will do it, and they feel too, they also feel the change in their body. They also feel a sense of relaxation. So it's very good when you teach them, because when they grow and when they deal with difficult situations in their life, it's easy for them to fall back to these modalities, because they had experienced it while growing up, that this can help us relax. Okay, so I really encourage to do these techniques with children as well. Let me just move on with the presentation. So we spoke about unexpressed anger. Then so unforgiveness is another thing that I want to speak about. So unforgiveness can lead to diabetes, pain, and heart attack. Now, forgiveness, all of us know, right? When we go through a difficult situation in life, or somebody does something wrong to us, or we end up doing something wrong, something that we feel that we shouldn't have done this. How could I do this? Or you come across an incident that is not pleasant, and then it's difficult to forget and forgive that incident or that person, or forget to forgive yourself, like okay, fine, I could do it. It's difficult to do that. What happens basically is that we feel internally that if we are holding on to that memory, or the if we don't forgive, then we will not allow ourselves to repeat that thing again. Okay, we will not allow, and we will not go through the same pain that we went through when something like that happened, or when somebody did something wrong to me, or when ended up doing something wrong. So when you don't forgive yourself, you don't allow yourself to be free, because you feel that if I become free again, I'll again do those mistakes, and I'll again experience all the negative experiences and emotions that I had to face that time. So but every time you revisit that memory, or every time you go back to that person, or you remember what you did wrong, you relive that incident. You relive that incident, and all those negative hormones are generated in your body again, and you feel the same stress and trauma that you had experienced earlier. So every time, so imagine you've gone through it once, and then every time you remember it, every time you're releasing the same negative hormones and the negative energy in your body, and this leads to illnesses. Okay, this leads to diabetes, pain, heart attack. People who have diabetes, they're perfectionists and they're very hard on themselves. They have this very strong feeling that I was not treated correctly. Okay. And when somebody has a feeling like that, that person will always, want to be in control. Yeah. Somebody who has pain, a lot of joint pain or body pain is also emotions, stored emotions in the body. And somebody who has heart issue, somebody who has a heart related issue, such people also tend to be controlling. They don't want to let go of the control, and they tend to hold a lot of pain and trauma in the heart. Okay, a lot of pain, trauma, and fear as well. So moving on. So yeah, so unforgiveness can also lead to such illnesses which are chronic and it's difficult to heal. All right. So what can you do about it? Okay, figure out a way that works to release your stress, use clinically proven method to free suppressed emotions, and learn a method to reverse past traumas and create health, because a lot of times it's not possible for an individual to do it on their own. So you must reach out if needed. You must reach out to a professional or somebody who is trained in dealing with past trauma and create a better health. Okay, so we um, we are here for emotional freedom techniques, and it's a clinically proven method, so we're going to speak about that. And EFT helps in overcoming stress, eliminate pain, heal the past, defeat the phobias, heal past traumas and accidents, stop food cravings, binge eating, etc., stress eating. And it also helps in breaking through limiting beliefs. But there is EFT and then there is clinical EFT. So a lot of us, are aware of EFT, which is on YouTube, right? You tap on different points and it feels really good. And plus, we speak about positive affirmations. We speak about, good things that we want to experience in life. But the way we approach towards EFT, our approach towards EFT is a bit different. Okay. So when somebody comes to us, like I mentioned earlier, we make sure that the person is relaxed. We make sure that through our exercises or through the techniques that we've learned, we help the individual to relax in the nervous system first. Now, what is clinical EFT? So, like I said, it helps you to relax your nervous system, and then we talk about the issues and the problems that we have. Now, EFT basically is a combination of acupuncture meridian points and modern age psychology. So we have, like all of we have different points, meridian points on our body, and these meridian points are connected to different organs of the body. Now, in acupuncture, it's believed that different organs of the body hold different kinds of emotions. All right, and when we don't know how to let go of that emotion, that organ, the functionality of the organ becomes, it gets deteriorated. Okay, now somebody who has more stamina, who's more physically fit, might you know might be able to pull their health through for a very long time. But if they don't know how to deal with the emotions, and if they have a tendency of holding on to emotions, the body will give up after a certain amount of time. Okay. So in EFT, we tap on these different points. It helps the organs relax, and it helps, physically to release the stress these organs are holding on to. Plus, I spoke about the questioning skills, right? So then we have a specific way in which we ask the questions to the client. We ask them how, what are they dealing with, and we try to go to the root cause of the problem that they are facing. And then, while uncovering the stress and the trauma that the client has gone through, we tap on different points, and that helps them bring a transformation in their life. It helps them to uh, change their life, the struggles, release the struggles, change their life, and choose a life that they want. Okay, it also helps them to release when you release these old patterns, you release these old traumas, you release the old emotions that you're holding on to, the functionality of the organs improve. Okay, and the health parameters also improve. And suppose you're going through any treatment. Now, when we are doing this, we never encourage you to stop taking the medical treatment, okay? Because we are not medical doctors. So you must take your medicines, you must visit the medical doctor. If you have any ailment as such in your body, please don't stop your medical treatment. But what happens is that, when you seek therapy while having those issues in your body, the treatment, it becomes accelerated. The results are faster. You see a transformation in your body. Sometimes without medication also, your body tends to heal on its own without medication too. Okay, so moving ahead, so I hope I made myself clear that what clinical EFT is, and what's the difference between clinical EFT and the EFT that we see on the internet or on YouTube. So moving on, just give me 1 second. Okay, sorry, I'll have to reshare my screen again. Yeah. So this was a study done on war veterans. Okay, they were divided into two groups, and the first group went for 6 EFT sessions, and they saw a shift in the post-traumatic stress disorder criteria by 90%. Okay, in 6 sessions, they saw this change in them, and studies have shown that long-lasting reduction in post-traumatic stress disorder happens for people who opt for EFT, and people who have standard care, they see only 4% reduction in the symptoms of post-traumatic stress disorder. So what is post-traumatic stress disorder? Okay, somebody who has gone through immense stress or trauma, they are not able to get over it. So I'll give you a couple of examples which will make it clear. So I know somebody who was in Canada, and she and her 4-year-old son and her husband, they were in a car, they were driving, going somewhere, and the car met an accident, and the car completely, was destroyed. Luckily, by God's grace, the wife, the husband, and the child were safe. Now, this was during COVID, and when this lady was working, it was work from home that time, right? So when this lady was working at her house, she would not feel safe when her son would go out of sight. So she used to get panic attacks every time he would move, even outside the room. And that made her wonder that something's wrong with her, because this was not happening before. And suddenly she cannot deal with this, that, the moment he goes out of sight, she feels unsafe, she gets a panic attack. So then she went to a psychologist, and the psychologist uncovered that she's going through post-traumatic stress disorder. So the trauma of going through that car accident was so strong that the idea that her son is out of her sight made her, feel that something wrong is going to happen to him. And then the doctor suggested her, the psychologist suggested her to go for therapies. Another example, like, people who have special need children, especially autism, etc., they tend to have symptoms of post-traumatic stress disorder because they are always in this hyper-vigilant mode, where they're always, on an alert mode, where they feel that, I hope my child is safe. I hope he's not, he's not harming anybody. I hope he's not harming himself. For example, my son is on the spectrum, and few years back, we had gone to a friend's place, and they live on the 26th floor. Okay, and the balconies did not have railings. Now, there were kids playing in that room, and my son was along with them, and my cousin was there. So after some time, the kids went away, and when my cousin turned, he saw that my son was sitting on the balcony with his feet out. Okay, and thank God my cousin was there, because he silently went, he picked him up and got him back. But when I got to know about it, I was like, I got a panic attack, and I was like, thank God I wasn't there, because if I would have seen him, I would have probably screamed. And what if he would have lost his balance, And thinking about that, I used to get really hyper all the time. So every time I would go to their place, I used to feel that, oh my God, close the windows, close the balconies. And, so this is like a small example of what PTSD can do, because when you come to a situation like that again and again, you feel that okay, something will go wrong again. You're always in that mode, okay, something might go wrong, something might happen, right? So EFT, results have shown that PTSD symptom, and when you're in that hyper mode all the time, your body is in stress all the time. You cannot relax, you cannot calm down. All right. So yeah, EFT has been proven to be very very effective for people who have experienced post traumatic stress disorder. Yeah. So moving on. I'm sorry, my computer is behaving a bit funny. I'll have to reshare this again. Okay. So EFT, these are some of the places where EFT being is very, the studies have shown that EFT has been very effective. So people who want to give exams, who have stress and anxiety before test. So EFT has been proven to reduce anxiety for exams. It's been proven very good for people who it has improved athletic performances of people who are into sports, etc. It decreases pain, distress, and cravings. So food cravings also, can be countered through EFT, because food cravings generally is because you're trying to suppress an emotion by binge eating, or getting addicted to a substance. So some people eat a lot of sweet or chips, or soda, cold drink, etc. Some people have substance abuse as well. So a lot of cravings can be handled if you touch the root emotion, that what's going on, why am I what's the reason that this food item is making me feel comfortable. And when you understand that emotion and you tap it out, the cravings go away. Okay. Similarly, phobias, fears and phobias. So I remember the story of a lady who was learning EFT with me, and she had a very very strong phobia of lizards. So she couldn't even look at the picture of the lizard. Okay, that it was that bad for her. And she said, and she used to run dancing classes, and she said that if I enter a space, if there is a lizard over there, I cannot move into that room. So when we worked on her, she realized that when she was 10 years old, she used to get these dreams of crocodiles, and she was 10, and she used to get really scared, and she used to pee in the bed, like she had bedwetting issues. And that her parents used to be really hard on her. They would scold her, or they would tell her that this is not done, why do you do this, you're 10 years old. So this was a traumatic incident for her. All right. And she associated crocodiles with lizards. So every time she would see a lizard, she would get scared. So after we worked on her, we released her trauma, etc. Next day she came and she mentioned that, I was able to move into the room and shoo the lizard away with a broom. So, from not being able to see the picture to actually getting into the room. So that was huge. So just trying to give you an example of how we can work on fears and phobias as well. Okay, you identify the emotion, you identify the root cause, and then you try to, resolve it, and then it gets better. Okay. Then EFT is also, helpful in reducing depressions and fibromyalgia. These fibromyalgia is very difficult pains in the joints, etc. So it's been proven very effective over there as well. Now, some people, let me share my slides again. Yeah. So people who are on weight loss journey, EFT is effective for them as well. This was a test done in Australia. So by this lady called Pete Stapleton. She had, you know, so these people were sent into their brain was sent for an MRI scanning, and they had a camera. They had a camera on their. Um, if you can see this image, they had a camera on their eyes where they were shown images of different food items like burgers, soda, ice cream, cookies, pizza, etc. Okay, and this was the brain scan. All right, so this is the orange part that you can see. It's called the amygdala. Okay, So before EFT, the brain signals the body for an addictive craving. So every time they saw those food items, the brain, so amygdala is basically the pain pleasure center of the head, okay? And every time it's feeling uncomfortable, it starts signaling the body that, I need something. I need something to soothe myself. I'm uncomfortable. And food cravings increases, okay? So it starts thumping. And after 4 weeks of EFT, brain does not signal for a craving. Okay, the brain is, so the same images were shown to those people and the brain was absolutely normal. So the cravings, so there was a reduction in addictions and cravings. Now, EFT also shows long lasting effects in weight loss. Okay, so this was the study done in 12 months period where people were having EFT. They were, so as and when they started releasing trauma and emotions from the body, the weight also started to reduce and it sustained, like it sustained. And even after losing weight, they did not gain weight again. It was sustainable. Now 76% of the EFT treated patients show full reversal in anxiety, which was confirmed by brain scans. Okay, and partial reversal of anxiety was 90% and sustained improvements after 1 year. So this is basically the brain scan. Okay, this is what a normal brain looks like. And somebody who has generalized anxiety disorder, the brain would look like this. Okay, so after 4 sessions, the brain, almost 50% of the brain was better. After 8 sessions, almost, 3/4 of the brain started functioning better, was like normal brain. And after 12 sessions, all the entire brain was almost like a normal brain. The blue area is the normalized area. Now, this was a study done with health workers. So it was burnout in 217 health workers improved by 45%, with a reduction in pain, cravings, and distress. Okay, symptoms, intensity, and breath improved. Okay, after EFT sessions. Now, in depression also, 41% of reduction is observed based on reviews of 20 studies. Decrease in depression symptoms with EFT. Now, physical pain decreases with EFT. Now, pain sensitivity, pain interference, anxiety, somatic symptoms, depression, all of this decreases. So the quality of life becomes better, satisfaction with life becomes better, and happiness becomes better. What is pain interference? So pain interference is basically, um, if you have a lot of pain in the body, then how much does it interfere in your daily day-to-day routine? Somebody who has, like, I remember I had a very bad sciatica pain, I think almost 3 to 4 months back, and I did not want to move at all. If I was sitting at one place, I would prefer to sit there. So simple things that putting my clothes into the laundry, or just even taking a glass of water, I would always call my son that, why don't you come and do it for me? So this is what pain interference is, right? It interferes in your day-to-day life. So that reduces when you do EFT. Okay. Yeah. Again, so this was a study done in 2020. So EFT group tapping reduces 43% of cortisol levels. And psychoeducation, so this is CBT, okay, cognitive behavior therapy. It decreases 20% of the cortisol levels, and no treatment reduces only 2%. So basically, CBT is also very effective, but EFT is, increases it makes the therapeutic results faster. The results are much more stronger than what we observe in CBT. Again, this is a similar chart where it shows that 57% reduction in pain, 40% reduction in anxiety, 35% of reduction in depression, cortisol, PTSD, food cravings, blood pressure. As a result, your immune system becomes better and you tend to become happier. So this is one of our fellow EFT practitioners, and she mentioned that her blood pressure was stabilized after she started taking EFT, and she also lost a lot of weight when when she learned EFT. She did not want to lose weight, but when she started practicing so much, she started losing a lot of weight, and she was able to let go of toxin emotions that were holding her back. These are some of the celebrities who use EFT. And these two ladies, they have learned from Vitality Living College. She's Natasha. She's a TV actress, and she's a beauty queen. She's a winner of Beauty Queen pageant. I'm forgetting her name. So all these people, they use EFT regularly. Now the 7 steps of EFT. Okay, I'll just read it out and I'll do it with you. Okay, we identify what the issue or the goal is. We get the measure of it. We start EFT tapping on the side of the hand. Then we tap on the other upper body points. Then we close the sequence. Then we relax and we test. Okay. So the first step is identifying the goal or the issue. What do you want? What issue do you want to solve? And how does it make you feel? So number one is to identify the goal or the issue. So an issue could be that I have a headache and it's making me feel restless. A goal could be I want to read 3 books in a month, but I'm not consistent and that makes me feel helpless. Okay. So what I'm trying to do is I'm trying to give you an example of what a goal or an issue could be. And once you've identified a goal or an issue, then you identify what is the underpinning emotion. Okay. If I have a headache, my issue is a headache or a knee pain or a back pain, or maybe I had a fight with my child. When this is your issue, how does it make you feel? So the underpinning emotion could be I'm feeling distressed, I'm feeling sad, I'm feeling restless, helpless, anything. Okay. Similarly, you can have a goal like I want to read 3 books in 3 months. I want to reduce 5 kilos in 3 months. I want to earn so much money in 3 months span, 5 months span, whatever. Or my goal is to work on my suppressed emotion. Any of your goals, okay, you can pick up any of your goals, and then when you have that goal, you identify when you're not able to achieve the goal, how does it make you feel? So we identify the underpinning emotion. All right. And then when we have identified the emotion, we give it a measure. Okay, we give it a measure on a scale of 1 to 10, that where 10 would be maximum. Like if I have a headache, I have so much of headache that my head will blast off, and we give it 10. And if my issue is a headache, and if I give it 1, that means I have no headache at all. Okay, so on a scale of 1 to 10, you measure your issue. Then moving on, we begin tapping on the side of the hand. Okay, we begin by tapping on the side of the hand. Let me show you the image so that it becomes clearer. So this is the side of the hand under the little finger. It's also called as the karate chop. Okay, it's also called as the karate chop. And when we start tapping here, so you can tap on any hand, okay, with 1 finger, 2 fingers, 4 fingers, whatever is comfortable. Or you can even rub your hands like this, or you can also tap like this. I'll show it to you again. And when we start tapping, begin tapping here, we have a setup statement that even though I have this problem, I deeply and completely love and accept myself. Okay. So like I mentioned, we begin by tapping here under the little finger. And I would really request all of you to turn your cameras on so that I can see what you all are doing. And then it also helps you connect with your energy and take it ahead. Okay. So we begin by tapping under the hand, on the side of the hand. And you can do this with me so that you understand how it is. And when we tap here, we say, even though, so we can also rub, or we can also tap like this. Yeah. And when we tap, we say that even though I have this issue, I deeply and completely love and accept myself. Okay. And we repeat this 3 times over here. So even though I have this issue, I deeply and completely love and accept myself. Even though I have this issue, I deeply and completely love and accept myself. Even though I have this issue, I deeply and completely love and accept myself. Okay. After we did this, we move on to the facial point. So the first point is where the eyebrows begin. I'm coming closer to the screen so that you can see. We tap here where the eyebrows begin, okay? And this is the bladder point. Bladder holds on to a lot of fear. I'm just explaining, which point is connected to which body part so that you understand that these meridian points are connected to different organs. And you can do it with me. So you can either tap on both sides, or you can tap on any of the sides, or like this, whichever is comfortable. It's a very forgiving process. And if you're yawning while doing this, it's perfectly okay. Okay, because that means your body is releasing the stress that it's holding on to. So, feel free to yawn if you have to. Now, next point is the temples where the eyebrows end. Okay, now this is the gallbladder goes through here, and there's also a point, triple warmer. Okay, and I think it regulates the hormonal system. And gallbladder has a lot of suppressed anger, and people who cannot make healthy boundaries, the gallbladder is impacted. Okay, so this also helps stimulating the gallbladder. Then we go down under the eye. This is the stomach meridian. Now, this holds a lot of worry and anxiety. And if you have acidity, okay, then you can do like this, because the meridian, stomach meridian goes like this, it goes in a cross way. So if you do this, if you cross your hands and tap, this will help you in acidity. Okay. So this is fine, this is fine, this is fine, this is also fine. Like crossing your hands and tapping is also fine. Okay. So if you're worried or you're upset or you have acidity, you can tap under the eye. All right. Next is under the nose. This is the large intestine. So we tap like this or like this, whichever is comfortable. Yeah, with both hands, whatever. Now, while we are tapping on all these points, we repeat, simultaneously we're repeating the statement. Like we started with, even though I have this issue or I have this problem, I deeply and completely love and accept myself. And when we are tapping on these points, we repeat that I have this problem, I have this problem, I have this problem, I have this problem. We are repeating the statement because we are addressing the problem or the issue that we are facing. We are not running away from it. We are not avoiding it. We are speaking the truth of it, that I am facing this problem. Okay. So addressing the problem is very important before coming to a positive conclusion. A lot of times we might feel stressed and you're like, I know this is a stressful situation, but I'm strong enough. I will try to, think positively, or I will look into I will look what it is trying to teach me. But a difficult situation is creating a lot of stress for you, right? So it's important to address that I am feeling stressed. Okay, so this was the large intestine. Large intestine holds on to a lot of things. Okay, if your large intestine is blocked, you might have issues like constipation. You might find it difficult to let go of things. Yeah, so this is the large intestine. Then we come here on the chin. We come here on the chin. This is the central meridian. Again, it helps in balancing all the hormonal system. And then we tap under the collarbone. This is your kidney meridian. Yeah, it holds a lot of fear, frustration, anger, a lot of resentment. So tapping here, or some people prefer tapping like this. Some people might just want to just massage on these points like this. Any of which is okay. Okay. So once we tap on all the here we are at the kidney meridian. Again, you can tap on either side or both sides, whichever is comfortable. Then we come on to the spleen, which is under the arm, like about one hand span under the arm. For the females, it's on the bra strap. For the men, it is on the nipple line. And you can tap here, or you can tap like this. Yeah, or you can tap like this, whichever is comfortable. Okay, or just on the one side, that's also okay. So this is the spleen meridian, and yeah, spleen helps you to regulate the energy of the body. People who tend to feel sleepy after eating food, probably the spleen is not functioning properly. So this helps you to regulate the energy. And also, somebody who has chronic stress, this will help. Now, when then we come to the fingers, okay? So then we place our hands like this, where the thumb is towards the ceiling, okay? And then the outer edge of the nail, we tap on that. Okay, so if you can show it to me how you're doing it, then yeah, Smita. Not here, okay? Over here. Then we come on the index finger, on the same side of the nail. Then we come on the middle finger. Then we skip the ring finger because the point is here. And in case you end up, tapping here, no horns will come out. It's okay. Sometimes we do it by mistake. But we tend to skip it to avoid confusion. And then we come on the little finger. And also that, this point we are covering on the facial area as well. So if you skip it, you're not missing out on anything. Then you come on the little finger, and then you come back to the karate chop or the side of the hand, and then you repeat the statement again. Even though I have this issue, or I have this goal and it's making me feel like this, I deeply and completely love and accept myself. Yeah. After this, you take a deep breath in through the nose, breathe out with the ha sound, ha, through your mouth, because again, it helps you to clear the lymphatic system, and then take a sip of water. Make sure that you're drinking water, okay? Hydrate yourself well, because all these exercises, they release a lot from your body. So water helps you to relax, okay? Lovely. So let me show you the points again on the slide so that it becomes clearer for you. Okay. So we spoke about, so there's this point at the top of the head as well. There are thousands of meridian points at the top of the head. So we tap here only when we're talking about positive things or when we are feeling positive. Okay. So we avoid tapping here if it's not a positive statement. We tap here only when we're feeling positive. That's the reason I did not demonstrate it. Also, yeah, another thing that I wanted to share was, like, somebody, if somebody is trying to get pregnant or is pregnant, then we avoid the index finger. Okay. We avoid the index finger, and yeah, I'm not sure what's the reason behind it, but people who have expertise in acupuncture, they say that it probably has meridians which are connected with the reproductive system, so we avoid the index finger. Okay. Yeah. So yes, so these are the points. Like, oh my god, my system is behaving funny. I'm not able to. Yeah. So then we came back, like I mentioned, we come back, we close the sequence here, and then we drink water, we relax, we take a deep breath in, breathe out, relax. Now, after this, we ask the client, how are you feeling? Okay. What happened? And we say whatever the client responds, we'll say that's great. So the response could be, I felt better. The response could be, I feel the same. Or the response could be, I felt worse. Okay, any of which is fine, because I'll explain it to you. So if you felt better, clearly the entire system helped you. If you felt the same, that means your specific words need to be used, to bring a difference in whatever that you're feeling. And if you felt worse, that means something deep rooted in you has been touched and it wants to come out. And that's why you're feeling that emotion even more intensely. So it's good, because then we can help you out to dig that thing out and throw it out of your system. So basically, when you come across a difficult situation in life, the energy in the body gets disturbed. When we tap on these points and we speak about the issue, the energy starts to regulate, and you feel a sense of relief and relaxation. Excuse me. So we'll do a demo now. So I want everybody to breathe in, and I want all of you to please participate in this exercise. We're not too many of us, but this will help us. So I want you to take a deep breath in and breathe out. And just observe, where are you breathing from? Are you breathing from your nose, from your chest, from your belly? Is it, is it constricted? Is it restricted? Is it shallow? Is it blocked? And I want you to put it in the chat box. Suppose for me, I'm breathing from my nose, it's shallow, and I feel constricted at a number 5. Okay, right side constricted for Yogi. Thank you. So if you put it on chat or you just unmute and share it with me, then we can do the tapping for all of us. Shallow nose constricted at 7. Thank you. Louis Belly, can you also tell me how does it make you feel? Is it constricted? Is it shallow? Is it restricted? And what number would you give it? Shallow from nose. Thank you, Ruchika. Then I have deep diaphragm breathing. Thank you, Rekha. I would still encourage you to, participate in this exercise and see if you feel a difference still. Left side constricted. Thank you. Thank you, Tanuja. Okay, deep in belly. Thank you, Louise. I would still encourage you to practice this with us. Okay. So what I'm going to do is now I'm going to begin tapping. And I want all of us to tap together. And as you tap, you repeat after me. The statements that I say, you repeat after me. Okay. So even though my breathing is shallow, I deeply and completely love and accept myself. Even though my breathing feels constricted, I still choose to love and accept myself. Even though I'm breathing from my nose, I still love and accept myself. Even though I have shallow breathing, breathing from my nose, constricted breathing, left side constricted, shallow breathing, breathing from my nose, constricted breathing, shallow breathing, breathing from my nose, constricted breathing, shallow breathing, breathing from my nose. Even though my breathing was constricted, I deeply and completely love and accept myself. Take a deep breath in through the nose. Breathe out with a ha sound. Ha. Drink water. And I would like you to put in chat now, how do you feel? Do you feel any different? Is it the same? Is it worse? Or is it better? Or did you feel any kind of shift? Better? Okay. Wow, Rekha and Luz also felt better. I remember your breathing was already good. So much yawning. That's beautiful, Smita. Allow yourself to yawn, okay? That means your body is releasing so much, okay? Nala also said that she's better. Ruchika is better. Tanuja is better. Thank you so much for sharing. Okay. So imagine, in one round of EFT tapping, if you're already feeling better, your breathing is better, then what would happen in a hour-long session? And breathing, why did we pick breathing? And this is another exercise that you can practice on your own. So I'm sure most of you know already that when we are stressed, when we are angry, when we are not feeling okay, the breathing becomes shallow and faster or constricted, okay, or blocked. You will not breathe easily. And when you are relaxed, when your nervous system is relaxed, then your breathing is longer and deeper. So this helps you to release stress, and you can see the difference in your breathing, like how it regulates yourself, your emotions, and your nervous system. Okay, so I'd like to do another demo, say on physical tension. Anybody wants to volunteer and come with me so that we can do it together? Anybody wants to volunteer, wants to do it with me, play along with me?
Sure,
Anyone?
I can join.
You can do it? Yeah,
Yeah,
lovely.
sure.
Thank you. Okay, so I'm going to be with Yogi. I'm going to focus on him, but I want everybody else to tap along with us. Okay, even though it's Yogi's issue, and I know you did not volunteer, but I want you to make a note of things. I'm going to ask him certain questions, so you make a note of those things for yourself as well. Okay, so do you have any kind of physical tension, Yogi?
Yeah. Pain in my upper back, left side.
Thank you for being so specific. So you have pain in upper back, left
Yeah,
side.
yeah, correct.
Okay. And what number would you give it?
It's at a 7, but it increases when I'm about to sleep or when I'm sleeping and I wake up. So it fluctuates. You can probably give it 7.
Okay. So I'll stick to this right now. That it's okay. And how does it make you feel, this pain in the upper back? How's it making you feel?
I feel restricted.
Restricted.
Yeah,
Okay. So like he mentioned, he was so specific. He had pain in the upper back and it's on the left side, and it makes him feel restricted, and he gave him a number, he gave it a number 7. So y'all can make a note for yourself as well, that where are you feeling the uneasiness in your body, um, what number would you give it, and how does it make you feel? Okay, so I'll start tapping with Yogi, and all of you can tap along with us. Okay, so even though
even though
I have this pain in my upper back
I have this pain in my upper back
on the left side
on the left side
at a number 7,
at a number 7,
and it makes me feel restricted,
and it makes me feel restricted.
I still choose to love and accept myself.
I still choose to love and accept myself.
Even though
Even though
this pain in my upper back
this pain in my upper back
makes me feel restricted,
makes me feel restricted,
I still love and accept myself.
I still love and accept myself.
Even though
Even though
pain in my upper back
pain in my upper back
makes me feel restricted,
makes me feel restricted,
I still love and accept myself.
I still love and accept myself.
Even though
Even though
this pain
this pain
in my upper back,
in my upper back,
pain in the left side,
pain in the left side,
makes me feel restricted,
makes me feel restricted,
pain at a number 7
pain at number 7
makes me feel so restricted,
makes me feel so restricted.
this pain
This pain
in my upper back
in my upper back
makes me feel really restricted.
makes me feel really restricted.
It's on the left side
It's on the left side
at a number 7.
at a number 7.
I still deeply and completely
I still deeply and completely
love and accept myself.
love and accept myself.
Take a deep breath in, breathe out with a ha sound. Drink some water. And how do you feel now?
It's gone down to a 6 and it's shifted a little bit in the center of my back.
Okay. And how is it different from what it was earlier?
I think it's the restriction is easing out, it seems.
Okay. What else? Anything else?
Mm,
And is it still pain? Is it still
yeah, the pain is still there, but it's manageable.
pain? Is
Like it's a great reminder that I should tap more before sleeping and after waking up.
and okay. Okay. So let's do another round of tapping on this, okay?
Sure, sure.
So even though
Even though
my pain is manageable now,
My pain is manageable now.
It was at a 7.
It was at a 7.
It's at a 6 now.
It's at a 6 now.
I still love and accept myself.
I still love and accept myself.
The pain has moved in the center now.
In fact, it's gone to a complete right.
The pain has moved to complete right now.
Yeah. I mean, whatever the niggling effect that I feel normally in my back, it's moved to the right now. And if
Okay.
I'm able to focus, yeah.
Yeah. And restriction seems to be easy now.
Restriction seems to be easy now.
Pain in the right.
Pain in the right.
Manageable now.
Manageable now.
Pain at a 6.
Pain at a 6.
Restriction is easy.
Restriction is easy.
This pain in my upper back.
This pain in my upper back.
On the right side now.
Much better on the right side now.
Restriction is easy.
Restriction is easy.
Pain is manageable.
Pain is manageable.
Much better now.
Much better.
At a 6.
At a 6, yeah.
I still deeply and completely love and accept myself.
I still deeply and completely love and accept myself.
Take a deep breath in. Breathe out. Drink some water. How is it now? And others can also share if they're feeling any kind of shift.
Yeah, it's gone down. It's gone down to a 3.
Beautiful. So what's remaining there now?
Action, actually.
Okay.
The message that I got while I was tapping, awareness, I would rather say that I need to be less hard on myself.
Beautiful.
So that
Such
pain is
beautiful awareness.
just trying to be hard on myself, pushing myself a lot. So
Hmm.
I need to go easy on myself,
Yeah. Even though
even though
I was being really hard on myself
I was being really hard on myself.
and it was painful.
It was painful.
That was then.
That was then.
This is now.
This is now.
I'm open to the possibility of being easy on myself.
I'm open to the possibility of being easy on myself and trusting myself.
I'm open to the possibility of trusting myself. I'm open to the possibility of coming more in awareness.
I'm open to the possibility of coming more in awareness. That's right.
And I'm open to the possibility of taking actions now.
And open to the possibility of taking actions.
Relieving, yeah,
with being less hard on myself.
yeah. Open to the possibility of being less hard on myself.
Yeah. Awesome.
And choosing to love and accept myself anyway.
And choosing to love and accept myself. Yeah.
Take a deep breath in again. Breathe out. Yeah. Drink some water. We see, that there are changes and there are shifts in others also. Like my entire focus was on yogi, but others were tapping and you all still felt a shift. So this is called as borrowing benefits. Okay. When we tap together on, say, a particular person also on completely, in how do I put it? Completely on their issue, right? When we're tapping completely focused on their issue, still we see the shift because something in them is also getting resolved in us. We're releasing that too. Okay. So it's a beautiful process, this borrowing benefits. Left elbow pain went from 8 to 6. That's lovely, Ruchika. So thank you, Yogesh. Thank you for doing that with us. And yeah. So moving on. So how was it? How was the experience like for everybody? Anybody wants to share something? Okay, I'll move on. I just wanted to check with you, Yogesh. Are you feeling okay now? Like, how are you feeling now?
Yes, much better.
Beautiful. Thank you.
Thanks.
So let me just share my slides again. Just give me 1 second. We have some testimonials with us. This is Lou. She has learned EFT with us. And this is a client's testimonial. Okay. He said that I can confidently say that Lou has saved my life. My experience has been nothing short of a miracle, and I mean that as in true miracle, not as a figure of speech. After 36 years of physical pain and struggles and constant search for a solution, Lou and EFT has been the answer. I've been looking for all these years, and my recovery has been remarkable. So Lou mentioned that her outlook towards EFT changed after this testimonial. Like her belief on EFT also changed after she this gentleman shared this experience with her. So this gentleman, he had attended the training, and he mentioned that age-old pain in his back was gone in 20 minutes. I think this was the day one of the training, and in 20 minutes, his in physical tension exercise is what we did right now. So yeah, one thing that I forgot to mention is that when we um, tap, like when I was tapping with Yogi, I made sure that I was using only his words. I did not change his words. So I shuffled the words here and there a bit, but I made sure that I used the words that he used. Okay, like when he said, I want to be easy on myself, I'm being too hard on myself. So I made sure that I used exactly his words. And that's basically addressing the problem. And yeah, that helps you to release the stress from the body and also feel better emotionally. Okay, so moving on. Sorry, again, my computer is behaving funny. For some reason, I'm not able to move it ahead when I stop. Okay. So she's Dr. Gitanjali. She is a practicing medical doctor. She had a lot of grief in her life. Okay, she lost her father, her brother, and then her husband had cancer. So all of this, created a lot of chaos for her in her emotional life and personal life. And she mentions that these incidents led me to a transformative journey discovering EFT and ICM. I'll have to do this again and again because I am not able to. I'll just, reshare the whole thing again. Is my screen visible? Like, one sec. Can you see the entire screen, or are you able to see the PPTs?
Yeah, entire screen.
Okay,
It's
thank you.
yeah. Gitanjali.
Yeah. So this is Chaturi, sorry. She is a spiritual healer and a EFT practitioner, and she mentions that I could really truly love myself and accept myself and understand my worth, and it takes lifetime to master these concepts. But thanks to EFT journey, that I was able to begin the path with these concepts. And I so agree with her, because even I was into healing and uh, spirituality even before I got to know about EFT. But when I got to know about EFT, I got to know the true sense of loving yourself, how to accept yourself, how to love yourself, how to be okay with whatever that you are. So EFT has really helped me in that. Okay. And I can see there are some questions, and we will address those questions after I finish the slides. And my colleague Yogi, he will also share some links where you can read uh, around, if you have certain queries around certain health issues or some concepts. That so we have certain articles on our website. He's sharing the link where you can read more about it. Okay. And yeah, so moving on. Again, so sorry. Yeah. So this lady, she is a special educator. She works with special needs children, and she mentioned that she used to lack a lot of energy, and she had tried multiple things, and she had a lot of resentment, a lot of anger. I remember the first time I did EFT with her, her conclusion was, now I can take revenge from others. Okay, and I was a little taken aback with that, but she has been very committed to working on herself. And with EFT, she mentions that she was able to unburden herself, and she was able to take responsibilities with ease and look at situations, empathize with others. So she has released a lot, and she's worked on herself a lot. So this is a very beautiful. And she said, I've tried multiple things, but nothing has helped me like EFT did. Then we have Sejal Mehta. She's a trainer and a therapist. And she mentions that her fibromyalgia on the second day of training, 8 months old fibromyalgia disappeared. After this, I'm sorry, I have to, reshare my screen again and again because there's something technical glitches there. I'm not able to share it in flow. Yeah, so this is something that I want to talk about. So how do we work on the root cause? Okay, so we first start with the surface symptoms, and then we go to the deeper root cause. Now, what must be happening on the surface symptom? Like somebody is having a headache, must be feeling really, really restless. Okay, and the reason that they're having headache is because maybe they're having some beliefs, you know, that is pushing them to show up in a certain way that creates headache for them. I'll just show you the slide again. Okay, my PowerPoint doesn't seem, yeah, there it is. Yeah. So, I'm sorry for this. Yeah. So see, somebody, like I was mentioning, somebody who has a daily headache might feel helpless. And the deeper root cause must be, they must not feel helpless. They cannot say no. They need to have their dad's approval, or they must, to approve themselves, they need to have their dad's approval. And because, they want to validate these beliefs that they have, they overwork themselves and they get these daily headaches every day. And even if the belief is that, you must not feel helpless, they do end up feeling helpless. Okay. So I have some more testimonials to share. Just give me 1 second. I'll actually share this PPT with Yogi so that I don't find it difficult to share it on Zoom. There's some kind of a I'm really sorry for keeping you all waiting. Yeah. So moving on with the presentation. So there are a couple of other testimonials that I wanted to share. Okay. So yeah, we finished this. Yeah. So this lady, she's a trainer, and she was really scared of balloons. She couldn't attend any birthday parties or any event where there were balloons, and the reason was that she was really, really scared of the balloon blasting. Basically, when she was a kid, she was in a war zone, and she had seen a few family members die because of the bullet shooting. So the balloon bursting would remind her of that incident. And after taking EFT, she mentions that I had a very bad fear of balloons because of the violence where I lived. Every time a balloon would burst, I thought I would die. I'm not scared anymore. Where there is a celebration with balloons, I'm going to say, okay, come over. Okay. Now this lady, she works in LinkedIn, and she has to take a lot of flights, and she had a fear of flying, and she had come to me because she used to get panic attacks every time she used to take a flight. And in one session we addressed her issue, and she was able to, the next time after a month, I think, she took a flight, and she messaged me that I did not have a panic attack again. So basically she wanted to be in control, and the moment the flight would take off, she used to feel that, I'm losing control, I don't have control over anything, and if something goes wrong here, then I don't know how to deal with it, or I don't know how to overcome it. And that's the reason she used to get panic attacks. And when we addressed her issue, she had some childhood memories because of which she felt that, it was very important for her to be in control. And then her flying experience was really smooth. Now, this is another fellow EFT practitioner. Uh, she has worked on her chronic sinusitis and cravings, and as a result of it, she lost a lot of weight. So EFT has really helped me with chronic sinusitis, allowing me to breathe freely again. It helped me to address the root cause of the illness and assisted me in clearing past judgments. I was also able to shed a lot of emotional weight that was carried and was able to overcome my cravings for chocolates and chips. So these are few areas where, EFT is very helpful. Anxiety, accident, boredom, claustrophobia, depression, grief, guilt, headache, insomnia, limiting beliefs, love, pain, physical pain, panic attacks, sadness, shame, stress, self-image, sexual abuse, sports issues, trauma, war memories, weight loss, fears and phobias, okay, public speaking, dentist, rats, spiders, roaches, needles, driving, snakes, heights, water, etc. So EFT has been beautiful. Okay. Now, so yeah, before I proceed ahead, I would like to know how many of you are here for personal development, and how many of you are exploring this, uh, as a career option, or want to, or you all are already practicing and want to, so you can put P in the chat if you are doing this for personal development, and if you can put a, H in chat if you're already a healer, therapist, or a coach, and if you're looking forward to add another tool in your existing toolbox. So thank you so much. And so yeah, so your next steps, I'll just show it to you. I'll just show it to you. Just give me 1 second. So see, we have 3 programs for you, 3 options. Okay, one is inner transformation program, which is you attend. We are coming up with the EFT training now, which is starting on 9th June, and so it's called the EFT Fast Track program, and I am going to run the training. And so the inner transformation program is attending the 8-day EFT Fast Track, plus plus you attend inner child matrix program, which will be conducted by my mentor, Dr. Rangana Rupavi Chaudhary, but that will happen next year. So the combination of inner child matrix and EFT fast track really accelerates your healing. And in inner child matrix, it's a very strong and a quicker modality to heal your past traumas. Okay, and so if any of you are looking for inner transformation, you can put a T in the chat. All right. The second option that I have for you is that if you are looking to get certified in EFT, if you want to become a certified practitioner, so you can put a P in chat, okay, or put a EP in chat, okay, because you all have already put P earlier, so you can put EP in chat, EFT practitioner, so that if you want to, do all the case studies, understand how you can go about doing a certification course in EFT, what are the protocols, what are the requirements, and what is the procedure. So you can put an EP in the chat so that we understand so that we can help you with that as well. Thank you so much. And then if you want to learn EFT for your personal development, you can put EFTP in chat. Okay. So if you want just to learn it for yourself, to heal yourself, in the third option, you will also get a senior practitioner with you who will help you, who will give you 6 sessions so that you can, who will help you release a lot of trauma and stress that you're already experiencing. Plus, you also get to learn the modality by learning the 8-day EFT fast track with me, where you know how to work on your own, on yourself. So this is beautiful. Thank you so much. So the next step is, I am going to show the link. All right, where you, so I'm going to share the entire screen. 1 second. Yeah. So see, we will share this link with you. And once you click on this link, you will be redirected to this website. Okay, where all 3 options are given. And once you book a free call, once you book a free call, you can choose anything for yourself, okay, whatever you're interested in, inner transformation, EFT certified, or EFT personal. And once you book a free call, myself or my colleague Yogi, one of us will get in touch with you, and we will do a 45 minutes coaching session with you, where we will understand where you're coming from, what are your requirements, what is your need, and which is the program that will work best for you. And then we will guide you through that what is the process to move ahead in this program. Okay, so I highly recommend, any of you who are interested in EFT or want to be certified or want to understand more, I highly recommend this call, because this will give you a better idea of what is the process like when you want to learn EFT. Okay, and yeah, so then you can also follow us on Instagram. Vitality Living College is the handle. You can follow us on YouTube. Vitality Living College is again the handle on YouTube. And you can add me on Facebook. Sonal Sinha is my Facebook handle. So you can you can connect with us on social media, so that you can get more information about upcoming courses, or information related to EFT, etc. And yeah, that's about it. I let me just check. Yeah. So summary of today. Let me just, wrap it up with summary of today. So what did we learn today? Yeah, we learned that stress can lead to diseases and illnesses. Unresolved emotional upsets can cause diseases. Suppressing emotions is harmful to health. By releasing stress, freeing suppressed emotions, and resolving past upsets, you can create health and wellness. How EFT is clinically proven to lower stress, anxiety, tension with personal stories, and the steps to EFT process. So we covered all of this today, and yeah, that's about it. And if any of you have any questions, please unmute, or you can even type on the. There was one question. Okay. Can we do it for low confidence? Yes, we can do it for low confidence. Tanuja asked this. Is she there? Yeah. So, Rekha, 1 second, just let me answer Tanuja's question, and then I'll come to you. Okay. So yeah, we can do it for low confidence level. We basically, when we work, like I mentioned, we work on the surface symptoms, and then we go back, we trace back, go back to the root cause. We understand, where did you decide, where are the areas or the places where you felt that you couldn't be confident, or you lost your confidence, or your body went into a shock or a freeze response. And then once we address those issues, you will feel that you can become more confident. So I can give you my example. I had a very bad stage fright. Okay, I couldn't speak. I used to get blackouts every time I had to present, even online. So I worked a lot on my childhood issues, where maybe more was expected of me, and I was maybe slightly slow. Used to process things slower, and my guardians, teachers, mentors, they would expect me to process things faster. So that created a that made me feel that maybe I'm not good enough, maybe I can't do this, and I was not able to express it. So I've worked a lot on this to come to this level where I can talk confidently and freely. Okay, so it really helps in improving your confidence as well. I hope I've answered your question, Tanuja. Okay, let me know. Rekha, you wanted to ask something?
Yeah, yeah. I just wanted to ask that. Just a sec. I just wanted to ask you. Can you just repeat all the points, organs? Like you said, this is for stomach and this is for this. I want to repeat the organs related to the tapping points. Can you just do it for that once again?
So this was the. I'll do it quickly for you. Okay,
Yeah.
this was the bladder. This
Uh,
was gallbladder and triple wormer.
uh,
This is stomach,
uh,
large intestine,
uh,
central meridian,
uh,
and then you have the kidney,
hmm,
spleen.
hmm.
That's it. And this is the small intestine.
This okay. And this is the top of the head.
So this is we all know crown chakra, right?
Uh,
It has multiple
okay.
meridians. Yeah.
Okay.
So yeah, Louise has the question that in UK tapping on the top of the head seems to be okay, um, even for negative issues. So this is what my mentor follows, Louise, and the top of the head has a lot of meridians, okay, more than thousands. And when we tap here, we as Vitality Living College coaches and practitioners, we use it to integrate positive things. Okay, so when you tap here, when you feel positive and when you tap here, it integrates in your system. Okay, so we avoid using it for the negative things. I know a lot of people use it here, and if it works for you, it's fine. But we avoid using it for negative statements. We use it only for positive statements, so that the positive statements gets integrated into your system. Okay.
Yeah. Thank you. Thank you very much.
Thank you. Any other questions? Anybody else wants to ask anything?
I want to ask, when we have some kind of communication issues, like either we over talk or, we don't know how much to talk, like that. If our throat chakra is imbalanced, then what is the tapping that we need to do to sometimes bring ourselves to talk and be make ourselves heard, and sometimes to also know when we are over talking.
Okay. So see, there are 2, 3 issues here, right? One is that, you're not even feeling heard. One is that, I don't know how much to talk. And then there is an imbalance in the, sorry, come again?
different circumstances. I over talk or I miss to
Understood.
talk, depending on.
Yeah, understood. So what I'm trying to say is that, there are 2, 3 aspects here. One is that, you might feel that, you're not heard. You might feel that you're talking too much, or you might feel that you're talking too little, or you don't know how to balance your communication, if I've put it correctly, if I've understood correctly. Because communication is a combination of listening and speaking, both.
I know what to say, but I feel choked in the throat. In
Yes.
some kind of audio.
So see, there is no generic tapping for this. For this, I would recommend that you either you learn the modality or you go for a session where the approach. I'll tell you the approach how it is. We will tap on the surface symptom, like when you sense this kind of a choke. So like you mentioned 3 things. So I would first ask you which is the most. I'll give you a priority. I'll ask you a priority, that which is the one which is troubling you the most. Is it feeling of not being heard, or is it not knowing how much to say, or is it not knowing when to say, what to say, or not being able to speak up, or speaking too much? So I'll ask you what your priority is. Then I'll ask you how does it make you feel, and tap on the surface symptoms. And then from there we will go back to the root cause. We will understand which memory got this belief in place. Where did you decide not to speak too much, or not to speak too little, or speak or where did you feel not heard enough? So once we go back into the memory and we heal that memory, or we release the emotion around that memory, then you're able to come back to balance, and then you're able to speak and express yourself better. So it's not a one session thing, or it's not a one tapping sequence. It takes time, because for every individual that will be different. So I cannot give you a generic statement around it. Have I answered your question, Meera?
Yeah. So typically, most of the times I don't know what to speak, when to speak, how much to speak, right? Typically, either I over talk or I under talk, and basically, I don't communicate the way it needs to be communicated. So, is there any general daily practice that I can do for I do the Reiki, I do it for the throat chakra, and I also do that the chanting of the various lum and those things. But I'm not seeing a visible improvement like that. So any daily practice that can help
So
with it?
in EFT, you will, so whatever your issue is, you are aware of your issue, right? One of the easy ways that you can do is take a piece of paper, write down on a piece of paper everything that you're feeling. Okay. Say that so my throat chakra is blocked, and I'm not able to speak enough, or excuse me, I'm not able to speak enough, or I speak too much, or I don't know where to say, what to say, or whatever that's going on in your mind. Just write it in a very raw way. Okay, like don't correct it. Don't try to correct it, or don't try to console yourself that even though I'm feeling this, I'll try to be like that. No, just write it in a very raw way, that this is what I'm feeling. And once you've written everything, you can read it out and tap it out. Okay, this is something that you can do every day. So every day, take a piece of paper, write down everything that you're feeling, because if you tap every day, you will notice a shift in you. Okay, there's a possibility that you might not notice, and when maybe if you're getting stuck and you're not noticing a shift, it's recommended that you get in touch with somebody who's trained to work on it. All right, otherwise if you want to do it on your own, this is one practice that you can practice, and the method that I taught you a few minutes ago, where you how do I put it, where I've taught you how to identify the issue, the emotion behind the issue, and then tap on it, give it a number, tap on it, and then do it again. Okay, is it clearer now, Meera?
I was thinking, this person who had this back pain, he could see the difference in, one tap itself, like it was moving from 7 to 6 to a
Yes,
3, like
yeah,
that.
that was physical tension. But see, there is a possibility that you will see instant difference. But if you're not able to see instant difference, like my mentor, Dr. Rangana Rupavi Chaudhary, who's the founder of Vitality Living College, she says I'm a 2-minute wonder. Okay, she used to have migraines every day. She used to take 4 tablets. Okay, she used to take this tablet called codeine, which had paracetamol, ibuprofen, and it's mentioned on the pack that it's addictive and you shouldn't take more than 2. She used to take 4 every day, and she couldn't do without it. And when she tried EFT in one round of tapping, from 10 the pain went down to 7 to 3 to 0. Okay, but because of the shift, she had to keep working on her emotions that would trigger a headache still. Okay, it is possible, if you are working like Yogi, I know he works on himself. He is also a EFT practitioner, so he knows the modality. So if you're working on yourself, it might not come back. But if you have like multiple issues because of which this is getting triggered, it might come back. Or maybe there are things like secondary gains and benefits. You decide to hold back to that trauma because it gives you a benefit in some way. Okay, so there could be multiple things, and somebody who's trained in it might be able to guide you. Yeah, we do see 2 minutes wonder, but we can't guarantee that that will last longer. You will see a shift, but if you want a permanent transformation, then you have to invest time in yourself. You have to understand where are your pains and traumas and difficulties coming from, and address it. Otherwise, even after some amount of healing, you will again go back to it. You will again go back to it. Have I made myself
Okay.
clear?
Yes, ma'am, it's very clear. Can I ask one more question, ma'am?
Yes,
This is
yes,
not
please.
specific, but in case of those who are neurodivergent, right? They have issues in terms of social skills. They have issues in terms of they're very intelligent in terms of IQ, their ability to do certain things. But because of their desire to be a perfectionist, they're
Yeah,
not able to meet their own standard, and they feel very inadequate, and and when they fail at some time, they're not able to accept it, and they become completely absorbed into a cocoon kind of thing.
yeah,
So
yeah.
and especially difficult for neurodivergent, especially teens I'm talking about. So what can be a good daily practice for these kind of people, because because they feel completely isolated and they don't want to even open up, so how
Okay.
can we help such
So I do. So depends on the individual. Okay, like I have a child who's on the autism spectrum. Okay, so he cannot communicate, but I tap with him because I'm kind of connected with him. So I intuitively I understand a lot of things that's happening with him. So every time he is upset or something, so I tap in him, and then he types and he expresses that I'm feeling this or I'm feeling that.
Okay.
Um,
Is it your son, ma'am, you're
Yeah,
talking
it's my
about?
son. Yeah, it's my son. So with him, I do this, and with others, it depends. How much can they communicate? What are they feeling? What exactly is one struggle that they are going through? So there are different ways in which we work. One is surrogate tapping, where it's like distance healing. Like you feel like the child, you think like the child, and then you tap on the child's issue, and then you're able to understand the child better, and then you're able to help them better. So when you understand their root cause and when you communicate like that, when they feel understood, they are bound to um, adjust better, perform better, and comply better. Like they will
Yeah.
listen to you more, etc. So surrogate tapping helps. If the child can communicate, then we can bring the child on board and try to understand like what are they dealing with. Because this cannot be generalized, because every child, like in autism spectrum especially, one child on spectrum is one child on spectrum. Every child has a different issue going on, or a difficult. And I would really recommend you to come on our program, because you will learn different ways to deal with this. How to, how are the different methods that you can use, so that you can bring them to ease or work with them in a better way. So my child, my story started with him. Autism started. I was like, I didn't know how to deal with it. My entire world fell apart, and because of him and all the chaos that was created, I was led to choose this path. And I was, and I realized the more I worked on myself, the more I understood him better. And I invested a lot of time in this, but it has actually helped me, create a life which is much more easier. Like, my son is outside and I'm sitting here and doing this training. It's a big jump for me, for personally. Like, I'm not boasting about it, but then I feel that I have really taken a leap, because there was a time where I couldn't imagine this as well. So, bringing him also on board, like, making him also learn how to relax himself when I'm not around. So all of it I could do because I could balance myself first.
So, yes, ma'am, makes a lot of sense. Is there any number I can connect with you, ma'am? Is it possible?
Yes, you can connect with Yogi. Yogi shared his number. I'm sharing it with you again over here.
Are
So
you
you
putting
can
it on the
WhatsApp
chat?
him. Yeah, it's on the chat.
Okay.
You are a part of the WhatsApp group, right, Meera? You will
Yes.
you can message over there
Yeah.
also and get in touch with you. Okay.
Oh, okay. Sure.
Yeah,
Sure.
or you can make a note of this number that I've shared. You can also connect with Yogi over here. All right.
Yes, ma'am. Thank you so much. That really helps.
Pleasure. My pleasure. So Rekha, had your son's autism any changes? So see, Rekha, it's an ongoing journey. Every phase has a challenge, but we are able to cope with it. It's not like, not able to cope with it, or we are in a frozen state. He is growing. He has his challenges. I'm learning with him every day, but the learning is not creating trauma and chaos anymore. It's an ongoing journey for him and for me as well. Yeah. Any other questions? Any other questions? Okay. Thank you so much. Thank you so much for attending today. And for those of you who are really interested in this, please connect with Yogi. I highly recommend you to have this call with him, because it will still add value to, you know, your existing journey. So thank you very much. And I hope to see you again. I hope that we meet again and we see each other more often. Thank you so much.